Brampton Lodge is a private care home situated in Folkestone, Kent. Throughout the COVID-19 pandemic, the care sector was hit hard. I wanted to see just how hard it was hit, so I arranged a behind-the-scenes look to find out more. First, I spoke to Claire Salisbury, a carer at Brampton Lodge. So how has COVID affected the way you care for the residents?
So it's been difficult in regards to having to wear masks, visors. It's harder to communicate because they can't see you. It's been hard. We haven't been able to come out for lunch and sit how they usually would. Usually to have four to a table. Now we're having to separate everybody, so it's harder for them to speak to each other as well. So just like the small touches are quite hard.
You mentioned wearing a mask. How difficult was that?
So in the summer months it was quite hard because you get really hot. We've all had quite a lot of breakouts on our chin when we've had to wear them. The residents have, they've taken to it now, but at the beginning they were quite scared when they saw us because it's hard to communicate with them. But on the positive side, a lot of us have found that we haven't had any colds or coughs during the winter months, so it's had a positive effect as well.
With the COVID guidelines coming into play, did you have to adapt your social life and take extra precautions?
So at the beginning of COVID, I had to move out of my home, so I live with my mum and dad, and my dad has Parkinson's, so I moved in with my boyfriend's mum and dad to keep my dad safe. So that was quite hard. That was for a good couple of months, and we just had to FaceTime. And also, we haven't been able to mix outside of work because the impact it might have if, so say for example, 6 of us met up. If one of us was to test positive for COVID, we'd all have to isolate, and that would have a massive impact on the workplace. So yeah, it's been quite hard.
Has COVID increased the workload in the care home at all?
Yeah, it has increased the workload. So just things like having to put on all the PPE, taking off the PPE, having to change PPE in between residents, that takes a lot of time. There's been extra cleaning that we've had to do, a lot of extra paperwork with the cleaning, with the testing, having to put all the tests on the computer, that takes a good sort of hour or so. So yeah, it's definitely made things a bit more difficult.
As we've heard on the news, Health Secretary Matt Hancock promised a ring of protection around care homes. I just want to know, have outside organisations been helpful at all?
So the clinical commissioning groups, they were not overly helpful. They just asked us to fill out a questionnaire every Monday, which took about 20 minutes, which during COVID isn't ideal. They now do it so that we can actually just contact them, which is better. And Public Health England, when we had an outbreak here, we had to inform them of what had happened. They rang us up and they weren't overly helpful. They were more trying to find fault in us and why what we had done wrong, rather than maybe how they hadn't supported us as to why we might have had an outbreak.
After speaking to a number of carers and members of staff, it had been made clear to me that this care home has struggled like the other 2,942 care homes hit by COVID-19 in the southeast of England. To extend my research, I spoke to the manager of Brampton Lodge to view her opinion. How has the restrictions affected the residents?
Well, it's been really hard on them because the major impact is that they can't see their friends, families or loved ones. They can't sit together and socialise as they normally would. They can't even eat dinner together round a table. It has to be all socially distanced.
With 1 in 3 people getting dementia, and I'm sure there's a lot of residents here with dementia, how did they react to the testing and the restrictions?
They don't really understand it even now, and it's quite frightening when you're putting a swab down their throat and you can't really explain why you're doing that because they just can't retain that information. They don't grasp the concept. So yeah, it's probably been really frightening for them, and it's not actually nice for us either, having to do the testing and restricting their lives. So
you've had to make many adaptations to follow the COVID guidelines. What's been the hardest?
I guess the hardest restriction has been having to work with the families and the friends of the residents that live here, because there are restrictions around visiting. We can't just have people coming in and walking around the care home. Some of the families think that maybe we're being deliberately awkward, and we're not, we're just following the guidance. So I'd say that that's probably been the hardest challenge.
With thousands of care homes contracting COVID in the UK, has this home been hit by it, and how hard?
During the first wave, we were lucky and we didn't get hit by COVID. However, just before Christmas, unfortunately, one of our residents had been in hospital, and when he came back, he was COVID positive, but the hospital told us he wasn't. And we were hit quite hard, all of the staff, and I'd say 95% of the residents suffered with COVID, and sadly 2 of the residents actually passed away as a direct result of COVID-19.
With COVID spreading almost like a wildfire, has staffing been an issue at all?
When we had the COVID outbreak, staffing was a major issue because so many of us had COVID at the same time, and therefore we had to get an outside care agency who provide temporary staff to supply us with the same carers to come in and cover all of the care staff that were off. This is difficult for the residents because they don't know them, and it's also incredibly expensive.
It's not just the carers that have struggled, but also the relatives of the residents. So after some time to reflect and a COVID-friendly haircut, I caught up with Tasha, a daughter of a resident here at Brampton Lodge. So initially, how has COVID affected your mother and her well-being?
Initially, I felt she was doing pretty well considering all the circumstances, but as time moved on, it did start to affect her, and it was also affecting me as well. So I realised it would obviously be affecting my mum. Probably it was worse actually for her, and because of the gaps with no visiting. But obviously we were doing Zoom calls, we were ringing her, even though we could see each other on the Zoom call, but the phone calls we couldn't actually see each other, you just couldn't hear her. But I knew with her voice, her manner, she had changed, and I think she was getting quite low over it because she was saying, "Oh, I just want to see you, I just want to give you a cuddle, and that'd be so nice just to see you in the flesh." So yes, it did affect her long term, mentally and emotionally.
So since the first lockdown, how many times have you seen your mother, and has it been hard, has it been tricky?
Yeah, it's not been easy, because obviously for myself, and I feel for my mum as well, because the initial with the initial lockdown, obviously because of COVID regulations in all businesses and certainly in residential homes, we had to do screening visits only, so we couldn't physically touch each other. But it was so good to see my mum just that way, if you know, because we didn't want to break any rules, obviously. And I do believe the home did it the best way possible. It was the only way we could do it, and I do feel as a home, and they're catering for lots of residents, including my mum, I think they've done marvellously well, keeping them safe, the staff safe, and keeping all the visitors safe as well.
Do you feel like the government have done enough to help protect your mother and other vulnerable residents across the UK?
Yeah, personally, I do feel the government did what they could. They did the best they could in the initial stages of this awful virus. And we had never seen anything like that, and neither had they. And certainly in my lifetime, I'd never experienced anything like this, especially with the lockdowns, the death rates, the R rating, and how quickly this was spreading through family members, through our own country and globally. So this would be a universal question to that answer, because I speak for myself and my own family and my own experience, and how it's affected my mum, and no doubt all the other residents and the staff and the manager and all the other managing staff as well, which I think throughout this they've done terrifically well. But the government, as time moved on, obviously there are a lot of problems of concerns for PPE in other care homes. I do realise at Brampton they weren't struggling so much with that, because I do think they had robust measures in place. And I do think that is the key, to have the robust measures in place in case of an emergency situation with this pandemic, because we knew eventually there'd be a situation, we just didn't know when.
After speaking to everyone, I was curious to find out more about what the manager thought about the government's actions, like the support bubble, and what could have been done to prevent the 400 weekly deaths in care homes.
Well, it's been crazy really, because there's so many changes on a day-to-day basis. Legislation just changes continuously, so it's hard to keep on top of it all.
You mentioned legislation. Could you go into a little bit more detail about that?
Well, every time the government make a change or make an announcement, legislation will change. So, for example, during the lockdown, it changes the way people can visit care homes, which makes a lot more work for us.
And during this, have you had much support from local authorities, or has it been quite tricky to get a hold of them?
Well, they would probably tell you, if you were to ask them, that they've been really supportive, but they haven't really. They are difficult to get hold of, and they don't know the answers to many of our questions. So I'd say no, not enough support has been given at all.
So after my time at Brampton Lodge, it's clear to see the devastating effect that COVID-19 has had on this care home. But this is just one of many that's been hit hard. Questions are still asked if more could have been done by the government to help lessen the impact of the pandemic.